Welcome, everyone. We have a very special week for you. We are together with our friend, Dr. Stephen Masley, who is a physician, nutritionist, a trained chef. I love that part. An author and the creator of the very successful public television show, 30 Days to a Younger Heart. He helps motivated people tune up their brain, their heart, and sexual performance. Now, we have talked about that, haven't we? How your brain, your heart, and your genitals are all connected because it's all about blood flow. He is a fellow with the American Heart Association and the American College of Nutrition, which is so important to do those two things together. His research focuses on the impact of lifestyle choices on brain function, heart disease, and aging. He's the best-selling author of a number of books, 10 Years Younger, The 30-Day Heart Tune-Up, Smart Fat, The Better Brain Solution, and his latest book, The Mediterranean Method. Plus, he's also written a number of scientific articles. We're so excited to have you on with us, Stephen.
Thank you for being here.
I think
I'm delighted to be with you.
Thank you. I think our audience really is going to be interested about the things we're going to talk about. The brain-heart connection, the brain-heart-gut connection, the brain-heart-gut genital connection. I mean, all of this is just
it really is
so important.
And I want to see a picture of that book again, because your book's coming out soon, right? It's beautiful.
December 31st.
Gorgeous. So we always love promoting books that are in line with what we recommend, and people get just more and more recipes. So that's fabulous. I'm assuming there's some easy things in there for people who don't like to cook.
Easy to prepare. And this is my first book ever where it comes out with like photos in it,
Beautiful.
To show some of the so some of the dishes. That's a first for me, that
gorgeous.
Something that you have photos of the meals as well, which that goes with the Mediterranean eating, right? The food is beautiful.
That's wonderful.
Colorful as well. So let's start in this podcast and tell us your story. How did you get interested in being a different kind of physician?
Well, you may not know this, but my dad was a surgeon and he worked like 90 hours a week. To see my dad as a child, I basically rode my bike to the hospital and I would find him in the emergency room, in surgery, in the ICU. And it was very intensive. So here's someone who's not old enough to drive a car, who goes to see his dad, gets scrubs on, scrubs up. And my dad usually would make me do a few stitches or something.
Wow.
And when I would see them in the intensive care unit, I thought, wow, this is awful. This is what they do to people in the hospital? This is terrible.
Yep.
So, people loved my dad. We had so many fruit cakes over the holidays, we could hardly find our own presents. But I dreamed that when I grew up, I'd be a doctor that kept people out of the hospital so they didn't need surgery and they didn't need to go in the intensive care unit. And that was my dream as a child. But you can imagine going to medical school and going through residency. It was frustrating because all our time was spent in the hospital.
Yeah.
So I had to reinvent myself, get a nutrition degree, go back to cooking school.
I love that.
To get to my childhood roots.
That's
what
amazing.
I wanted out of medicine, that was quite a journey.
That's amazing. You'll relate to this then, because I'm a neurosurgical ICU nurse. And so I worked in a level A trauma unit. And I had a really interesting story. There was a surgeon. He was a well-known surgeon on our unit. I worked at Loma Linda, so we saw a lot of high-profile cases. And I used to see him outside the hospital. He was overweight and he would smoke. And I'm like, how is that possible? How does this surgeon smoke, knowing what he knows, eat the way he eats, like stay overweight? I'm confused. But I also know, in their defense, their lifestyle is really hard to contend with. The hours that they work and, and such, it's really difficult. Well, I used to come in with my lunch bag every single day, and I was really into weightlifting at the time. So my lifestyle was the opposite of what a lot of people in the medical field is. And so I'd come in with my lunch bag, and he walks in one day to the lunchroom and he says, all of that healthy eating and exercise is only going to add a few years to your life. And my jaw hits the table. And I looked at him, I'm like, have you looked around our unit? It's really not about the number of years I live. It's really more about how I live those years. Like, I was so confused that,
Absolutely.
so it was just that Western medicine philosophy is just so different from the preventative medicine, so it's just so interesting. So you'll relate to that, I thought, based on what you saw.
Absolutely. I totally get it.
Yeah.
So tell us more. Why chef school?
That's so great.
I was doing research. I worked at Group Health Cooperative, which now is part of Kaiser. They are now part of the Kaiser family. And I was doing research studies on how to help reverse heart disease and what could people do for osteoporosis. And in the studies, when I did surveys and questionnaires on how to improve this, what the subject said over and over is, if you just gave us recipes that were easy to prepare, the food would taste good, and I could find the ingredients at the store, that's what I'll make, and that would make all the difference. I don't need all this detailed information.
Right.
And that was like a light bulb going off for me, that I really did need to start writing a lot more recipes than I ever wrote prescriptions as a physician. And that was transforming. And once I started doing that, that really did change my practice. I became more food oriented and practical. So yeah, I want meals to be easy to prepare, delicious. Your family and friends love them, and the nutrients nourish your heart, brain, and soul.
Right.
So I got a fellowship in nutrition with the American College of Nutrition, and I went to the Four Seasons and did a chef internship, and I got the results from my studies improved dramatically.
That's awesome.
So writing, I mean, that's like a headline, writing
Recipes.
more recipes than prescriptions.
That's a great soundbite, right? By the way, that's fantastic. Because there's not a lot of doctors who have that mindset. They're not trained that way. I think it's becoming a little more, the focus is shifting, but it's still not the norm.
But not the norm. Yeah.
No.
So, our friend Mark Hyman, I think, is the same way. And tell us a little bit more about some of the studies you were doing and how they informed your practice.
Well, we looked at a diet intervention exercise trial, and it was for people with heart disease. And we were looking at, could we change, behavior, risk factors. Initially, we tried adding an Ornish program. This was back in the early 1990s.
Yeah.
But I couldn't get even 5% of people with heart disease to follow it. They weren't, and even if they tried it, they would drop out within a month. So I realized this isn't going to work. And I'd always had an interest in a Mediterranean diet. And I thought, what if I did a Mediterranean version of this, where we would add more healthy fat, really focus on vegetable, fruit, beans, nuts, healthy fats, herbs and spices, make food taste great, simple to prepare. And my results were awesome. I mean, it was pretty amazing. And so when I ran my clinic for, over time, we would notice our average patient was shrinking plaque over time. We had hundreds of people that shrunk their artery plaque by more than 10 years.
Wow.
That the brain cognitive performance, doing CNS vital sign, our average patient's processing speed increased. We had hundreds of people who had more than a 25% improvement in brain processing and brain function.
Amazing.
So we could see that lifestyle had a huge impact. So I changed my whole perspective. If I put someone on a med, it's not like I never wrote a prescription. Let's be realistic. But I would usually say, I'm writing this because I failed you somehow.
Oh, interesting.
If I'd really made an impact, I wouldn't need to write this. And hopefully someday you won't need it. But for now, let's go ahead and start this. But the key is not this prescription. It's the other choices you're making.
I love that.
When that was quite a change in my practice.
So
Wow.
what you're saying, because I don't think most people believe this, is that you can actually decrease the amount of plaque you have on your blood vessels.
Most people don't know that.
Oh yeah, we've published this. But we were doing carotid IMT for 10 years, and we monitor every patient and track them over time. And our average patient's plaque was shrinking. The average American is growing about 1.5% more plaque every year.
So that reminds me, I mean, that sort of sounds like what we tell people, that you can make your brain better. It doesn't have to get worse as you age. And most people don't know that. They don't believe that. So, but you're saying you actually found the same thing in your practice, that cognitively they were getting better as their hearts got better. Because what's good for your brain is good for your heart, is good for your genitals. So.
Yes, it's good. Your circulation, your tissues, your function, everything. I mean, it all goes together. We're a matrix.
Right. And, I have to say, as someone who suffered a lot, my health was terrible, which is why I went into this field and went on this journey and wrote my book, The Omni Diet, was because I was just such a mess as a kid. I was one of those very sickly kids, ended up with thyroid cancer that was metastatic, kept coming back, couldn't figure out why, was on 9 medications, and it just didn't make sense to me. So as a nurse, I went, there's got to be a better way. And I went on that journey myself. And I just remember feeling as a patient, like, why is no one addressing me as a person? I keep getting sent to all these specialists. They keep layering my meds, not communicating with one another. It didn't make sense to me. I'm not a bunch of individual organs or systems. I'm a person. Like, why are people not addressing me as a person? And I'm a nurse. So imagine how frustrating it is to someone who has no concept of what they're doing with this. It's hard. It's very frustrating. So I applaud you.
I'm sure it was, but you obviously had wonderful results once you got out, once you've taken charge of your own health. So
well, and that's what we tell people, become your own advocate. And it's easier when you're in the health industry. So if you're not, then you find people like you, right? That's what we recommend. You find people that are holistic, that look at you like a person. You're looking at their heart, their brain function, their genital function, their sexual function. You're looking at the whole person. That's so important.
When we come back, we're going to talk about the brain heart connection, which is just incredibly important. And we're very happy that Dr. Masley's a brain warrior.
Let me see let's see his book one more time. That is such a pretty book. So if people want this book, when and where can they get it?
It's available wherever books are sold on December 31st.
Excellent.
And on pre-order at any time.
Excellent.
It's called The Mediterranean Method. You're listening to the Brain Warriors Way podcast. Stay with us. Your heart is coming up next.
We are going to start your new year, your new decade off with a bang. Tana and I are going to do a 6-week live class. So starting January 21st, every Tuesday, we're going to be with you for an hour. And at the end, we're going to give away over $20,000 in prizes. We look forward to helping you kick off this new year by becoming brain health revolutionaries.
Welcome back. We are here with Dr. Stephen Masley, the author of The Mediterranean Method and a number of other books. Stephen is a physician, but also a trained chef. What a
so
great
awesome.
Combination. And Stephen, I have this idea that if you want to keep your brain healthy, you have to prevent or treat the 11 major risk factors that steal your mind. And
Yes.
I came up with a mnemonic called Bright Minds that helps us remember them. And the B in Bright Minds is for blood flow. Low blood flow is the #1 brain imaging predictor of Alzheimer's disease. It's also associated with depression, schizophrenia, ADHD, and a host of other problems. And so why is that important, as we're going to talk about the heart? It's you have any form of heart problems, vascular problems, it damages your brain. And so I love the podcast we're going to do now, where we're going to talk about the brain heart connection. And the first time I knew anything about this was 1982. I just graduated from medical school. My grandfather had his second heart attack. And this is one of the happiest people I'd ever known in my life, who began with a major depression and ended up on antidepressant medication. He cried easily. He was negative. He was irritable. This was not my grandfather. And, came to learn that 60% of people who have a heart attack will develop serious depression within the next 18 months. So there's this huge connection between your blood vessels, your heart, and your brain. So can you talk to us about that?
Well, I really noticed that in the research in my clinic too, because when we looked at, I tried to answer a question: what would be the number one predictor of your brain, brain processing speed, using something like CNS vital signs? And we looked at weight and activity and strength and lab tests and blood pressure. But if you're growing plaque, that was the number one predictor by far. So plaque growth is intimately associated with your brain processing speed and your memory. And, I think it's twofold. One, obviously we need perfusion. We need circulation for any of our tissues in our body to work well. Our heart, our muscles, our genitals, our brain, any of them. But I think there's also something that we have physiologic needs that support the whole body. And whatever is supporting your brain is intimately connected to the same things that support your heart and help prevent heart disease.
So what increases plaque?
My bias is that the number one thing that's associated with arterial plaque growth is sugar and insulin resistance and uncontrolled, blood sugar, uncontrolled blood sugar. That's the number one cause. It's not cholesterol. I'm not saying don't worry about your cholesterol, but I don't think cholesterol is the number one thing. I think it gets so much attention because we can test it in a lab and prescribe a drug for it pretty easily. But blood sugar is really essential. But, there's several factors that we looked at. What things predict it? Your fitness predicts it. Your nutrient and vitamin intake predict it. Whether you eat enough fiber or not has an impact. So nutrients, fitness, food. I didn't have an adequate way of measuring stress. I'm sure stress has an impact on it. I was not able to measure that, but I believe it's really true.
So how do people know about the level of plaque in their blood vessels?
Well, probably nationally, the more common thing is they go out and get one of these CT heart scans, and it looks at old calcified plaque. I much prefer to see new plaque with ultrasound. There's no radiation. You can do it serially over time and see if your plaque's growing, shrinking, or staying the same. So intimal medial thickness is the measuring the lining of your artery, whether there's plaque in it or not, and the thickness. And the carotid artery right here on your neck is like the easiest place in your body to measure that. If you're growing it here, compared to when people had a heart study, there's a 95% correlation that if you're growing plaque in your carotid, you're growing it in your heart and vice versa.
So what study do they ask their doctor for?
Carotid intimal medial thickness, carotid IMT. Very different than like a duplex flow. That's looking for blockage. That's something a surgeon's looking for to see if you're blocked enough to document and justify surgery. My goal is you'd never need surgery on the arteries in your neck. We'd prevent that by intervening sooner and preventing that. But so in the hospital, we tend to measure, our medical clinics, we measure blood flow, and we look for, I think, cynically, I would say we're looking for someone who's at least 70% blocked so you can justify surgery.
Right.
My goal is to find people way sooner than that and try to avoid ever needing that.
Yeah. So you're focused on prevention. So you talked about blood sugar. What is your thought on saturated fat or animal fat? And I'd love to give people a tip before we wrap this up.
I've changed on this over time. For a long time, I was telling people to follow a low saturated fat diet. But I think the evidence linking that to heart disease has become it most controversial, whether it really is a huge, big factor or not. So I think an excess of saturated fat might be unwise. I think if you're having it in moderation, I think it's more important that if you're eating animal protein, that it's clean. It, you know, free
Grass-fed.
range, grass fed, wild. It wasn't, it came from a feedlot. I think that's more important than the saturated fat content. So I usually advise people to keep their saturated fat intake modest, but my emphasis on eating good fats, healthy fat, nuts, olive oil, avocado. I don't want someone on a low fat diet. I want them on a healthy fat diet, and saturated fat in moderation, I'm okay with.
What about butter versus margarine? Because that's a big question we get.
Margarine, I think is, you know, hydrogenated fat is like embalming fluid.
Right.
So I would definitely go with
That's
butter
good.
rather than I would go with margarine.
Okay.
But I would prefer they use olive oil than butter for most
Interesting.
things.
Well, and most butter is from cows that were given antibiotics, hormone, and that were grain fed.
Well, you
corn
can
fed.
get grass-fed
You
butter
can,
now,
but
You can.
it's harder, and I don't know that there's actually a benefit to it. It's just so interesting. I want to go back to cholesterol because my understanding, and I know you've written about longevity, is that what people don't talk about is low cholesterol under 160 has been associated with homicide, suicide, depression, autism, ADHD, and
Memory
death
loss.
from all causes.
But aren't we
That
like
cholesterol
creating a
makes
whole?
a significant amount of the fat in your brain is made up of cholesterol. Cholesterol also is the mother hormone in a sense, that hormones are made from cholesterol.
But when we
And
prescribe statins, aren't we like creating this whole slew
Well,
of people?
so many cardiologists, they want your cholesterol to be as low as possible. And I have a brother-in-law who's got like monster high calcium scores in his vessels. And whenever his cholesterol, because the cardiologist pounds the statins, he gets depressed. I mean, actually gets like
Right.
sad and tearful. And I'm like, no, you cannot go below a total cholesterol of 160. Do you have more to say about that?
Well, I think if people actually followed like the lifestyle you and I recommend, if they were to follow more of a Mediterranean diet, most people wouldn't qualify and need statin meds. Let's face it. If they really did this, they wouldn't need a cholesterol lowering medication. And when you do on them, no, I'm not into ultra aggressive therapy. I mean, muscle aches and it lowers your testosterone too. You said cholesterol, you're right. It is the mother hormone. Without cholesterol, you can't make testosterone and you end up with testosterone deficient, which impacts men and women. So it's not, you know, I think there's so many side effects with statins, and it's not that I never have written for them. I have. But my goal, again, is how do you not need them? Mm-hmm. And if you are on them, how do you be on the minimal dose so you can still shrink your plaque and document you have serial plaque shrinkage that's regressing heart disease at the same time? And I think following a Mediterranean lifestyle is probably the most effective way to accomplish that.
And would you agree or disagree with people when they say LDL is bad cholesterol?
Well, I'll be honest. Back in 1996, I called H for healthy and L for lousy for cholesterol. But it's a lot more complicated than that, as we have learned over time. And really, the particle size is far more important than the total number of total cholesterol or LDL cholesterol. So if you've got big, fluffy LDL, it doesn't really grow plaque. If you have little, tiny inflammatory, and that has a lot more to do with your activity and your stress and your blood sugar control than anything else. So I think really we have to, if we're going to follow cholesterol, we need to be looking at advanced markers and particle size.
Well, and part of why isn't it true that part of why they said that in the past was because we didn't have the testing methods we have now. It's changed, right? So
True. You're
it's
right.
not that it was
I
right or
totally agree.
wrong. It's that we've advanced. So,
Yes.
So there's an evolution to our knowledge.
Right.
I love this. This is so important. 2 quick tips before we have to stop on how to have a better brain and a better heart.
Food. I mean, eat real food. Vegetable, fruit, beans and nuts, spices and herbs. Cook with olive oil. When you use animal protein, make sure it's clean. It didn't come from a feedlot. That it's wild, grass-fed. natural food without preservatives and chemicals and sweeteners. That's number one. And number two is, how do we eat? It's about being joyful and leisurely and not being stressed out and not eating in front of a computer or phone or television. It's eating with people and interacting with people. So there's not just about what we eat, it's how we eat, I think, is equally important.
Great.
Excellent.
Stay with us. We're here with Dr. Stephen Masley, the author of the new book, The Mediterranean Method, out December 31st. Stay with us.
Welcome back. We are still here with our friend, Dr. Stephen Masley. We're talking about his new book coming out, The Mediterranean Method. You may have seen Dr. Masley on PBS, and we were just so blessed to have him here with us today talking about fast strategies. So we want to know what we can leave our listeners and our followers with that will help them feel better. You know, not just like through like post-holiday blues. People, we see them, you know, after sort of gorging from Halloween through New Year's. What can people do to feel better as they come out of the holidays and move into the new year?
I think maybe the biggest single choice we make is the food we eat. You know, what do we put on a fork and put in our mouth? And the key to me, you know, what I've learned, I've just spent 7 months sailing and traveling in the Mediterranean Sea, looking at how people in Mediterranean countries eat.
Now that
And
is
it's
research.
simple.
Yeah.
It's not complex. They're
I love
eating
that research.
simple, fresh, local food
Yeah.
without preservatives that they made themselves. Even the restaurants, it's like
I know.
a lot of
Yeah.
ma and pa like restaurants where they don't try to make 50 dishes. They make
No.
a few things really well. They don't overdo it. They don't make it overly complicated
Yeah.
like you might see in a restaurant in the US. It's simple, wholesome food without chemicals, without preservatives, without sweeteners.
Yeah.
Hit good ingredients, and then it tastes so good, you feel fantastic.
And there's not 15 choices for salad
I'm
dressings.
confused because I've seen this Mediterranean thing for a long time. But when we go to Italy, which is one of our favorite places to go, loaded with pasta that's gluten-based, loaded with pizza, which is gluten, dairy, and the fruit, tomatoes. People don't think of tomatoes as fruit, but they are because they have more sugar. So how do we...
I want to push back on that,
How
though.
do we reconcile what you think of
But
as an
wait.
Italian restaurant, a Mediterranean restaurant, and my experience in Italy with this is somehow good for me?
Wait, I want to push back on that for 1 second, because one thing I noticed was, yes, there is that, but a lot of the restaurants, it's homemade. It's actually made right there. But number two, this portion sizes were significantly smaller. And like you said, Dr. Masley, the farmers markets every morning when we stayed, was it Navona Square where we stayed? Every morning, the farmers market was right there, the little fresh market you go through, and people don't have big refrigerators. Where we stayed, there was no, like the refrigerator's tiny. You had to buy stuff every day. So it's the whole lifestyle is a little bit different.
Gluten, dairy.
Well, and
high
when the
levels
last
of
time we were there,
tomatoes.
there was a big shift. Everywhere we went, you could get gluten-free stuff. That was the first time I'd ever been there where I saw that.
Can get gluten-free
Yeah.
almost everywhere. It's a frenzy right
It
now.
is.
So gluten-free is more
First time I
available
saw
now
that.
than I've ever seen before.
And in Paris too.
And
But
the
William
portion
Davis would
sizes
say
are
gluten-free
dramatically
is a-
smaller.
Yeah.
Remember, when you think about a meal in Italy, you usually have an appetizer, which typically would be olives.
Right.
Or some vegetable, different vegetables that were marinated with vinegar, and which gives you stomach acid for digestion. And then you might have a pasta dish, but it's like 4 swirlfuls of pasta. It comes on a little salad plate.
It's a lot smaller.
It's not a massive platter like we would get here. And then you have your main course, and the main course is a big portion of vegetables and a small portion of clean protein.
Now, that's not to say, though, that in some of the cities, we've seen more westernization. But when
Yes.
you get outside the cities, like you said, on the Mediterranean, they don't even speak English, and they're a lot more traditional. That's what I
Much.
noticed.
So if you're in Rome and Florence and Venice, it's much more touristy, and
Right.
I don't see that as much. But I mean, mostly I'm in small towns,
Right.
small ports, markets, restaurants, and then so your biggest portion is vegetables and salad and the appetizer, which is olives, and
Right.
then they give you dessert. Here we charge for dessert. They give you dessert for free, which is fruit.
Right.
It's like melon or frequently berries or, pear and apple. I mean,
Yeah, in Greece they
Now
give
I'm
you
thinking about
Greek yogurt.
tiramisu and gelato.
Yeah, no,
and-
in Greece they give you Greek yogurt with walnuts and they drizzle a
honey.
tiny bit of honey on it, but it's so different from our desserts that we see here. It's so different.
Okay, so if I'm a brain warrior, and we generally recommend, gluten-free, because gluten has been shown to increase leaky gut.
Right.
If we generally, and that's what we do, generally recommend gluten-free, dairy-free. It's just this thing in my head. It's, when we were in Naples and you could see the pizza, which looked amazing, but I know for me, when I eat pasta and pizza, I get fat. And it happens quickly. So it's just better for me to ignore that. And
that's fine.
but
When-
you're
Have
making a really
fish.
good point. Doctor, I want to point this out. So in the Mediterranean method, I'm looking at a low glycemic
Right.
version. So I am leaving those type of foods you described as an occasional treat.
Right. When we went,
Europeans do not ban whole groups of food,
no.
but they don't eat them every day. So every day is more like vegetable, fruit, beans, nuts, clean protein, spices and herbs and olive oil. And lots of water. That's the essence of, so I'm trying to focus. I agree with you that we should be using a low glycemic version of a Mediterranean diet.
And that was the difference when we went to the cities versus when we were on the Mediterranean. It was more seafood and vegetables and a little bit of pasta, not nearly as much.
So if you want to age backwards and really decrease the amount of plaque, then if you think of a plate, 70% of it should be plant-based foods, 30% high-quality, clean protein mixed in with a whole bunch of healthy fat. And I think that makes the most sense in a low glycemic way because diabetes completely damages your body. You said that. You said that's like the number one cause of plaque is high blood sugar, which is an epidemic in the United States. According to a study in JAMA, 50%, that's 50% of the population is either diabetic or pre-diabetic, which is just a freaking nightmare when it comes to your body. And both you and I and Tana, because Tana's grandmother had diabetes, you see people, they don't heal. So they end up losing their toes. They lose their feet. They lose their eyesight. They lose their heart function. They lose their mind. And really a weapon of mass destruction is our high glycemic, low fiber fast food industry that is just destroying the health of
And I
America.
point out that, maybe one of the best looks at the Mediterranean diet was the EPIC trial out of Greece. And they went through and tried to analyze, which components have the most benefit, and which have almost none. And whole grains had almost zero benefit for the Mediterranean lifestyle. So when you think about the pyramid, the classic pyramid of a Mediterranean lifestyle, the classic one has grains like vegetable, fruit, and grains at the bottom. I pretty much took the grains out and put it up like with sweets and occasional, so I've turned it upside down.
Yeah.
That I completely agree with you that we need a lower glycemic version, and grains become optional. And if you do have them, they should be whole grain. And if you do have that, gluten-free is obviously an advantage. And the portion size should be little.
So I always say,
Little
eat them
tiny
like a
bits.
condiment. That's my
Exactly.
mantra is eat them like a condiment.
Yeah. So
I love
your process is just very similar to ours.
Very, yeah.
And before we end this one, what are some simple food takeaways that people can feel better fast?
Your predominant oil is the from fat you cook with is olive oil. That's easy. Extra virgin olive oil. It's nutritious. It's got tons of research that it's anti-inflammatory and it's got life-giving properties to it. I think an important thing is not to overcook it. You know, when high heat ruins it, it'll actually damage the fat. So you only use it at medium heat, something like that.
Yeah,
And cut out the sugar and cut out the flour. We don't really need those. So if we really focus on, as you said, 70% plant foods. I'd probably use 70% plant foods, 15% protein, and 15% of our plate is fat, which, which makes it 30% of our calories.
Yeah.
I think, we need to eat plain, simple, local plant foods, cut out the sugar, and we feel better dramatically very quickly.
So what's for breakfast in your mind? And speaking of that, I do intermittent fasting most days.
Me too.
Is breakfast important?
I think it varies by the person. So like yesterday I did intermittent fasting and I didn't eat from like 10 until noon. And I think that's very common in the Mediterranean that you skip breakfast. You might have a cup of black coffee or a cup of black tea, or you might just have water. So doing that 2 days per week, I think is what I've recommended for a long time. And that when you do have breakfast, I either usually, like today I had an egg and an avocado that I, whipped up together.
That's my breakfast. Either that or a smoothie.
Or a smoothie. That's my other one. A berry cherry smoothie with almond milk.
And then I'll usually add a scoop of acacia protein or fiber to it or something like that. But
And how about snacks? Last question. How about snacks? What are some snacks that, because, we're a snack society, and I grew up with Oreos and a Coke.
Well, and some of us like to graze. Some of us don't like to, I don't like to sit down and have a big meal. Unfortunately, dinner is usually the one meal I sit down to and have a larger meal. But I'm busy during the day. I'll forget to eat if I don't just have snacks to grab and go. So.
Well, that's an interesting thing because, in the Mediterranean, they don't really snack.
I know.
It's socially almost forbidden.
That's so interesting.
You eat meals and you have a leisurely long meal and you eat till you're satisfied and then you don't eat again till the next meal. But for snacks, my favorites would be nuts, dark chocolate, and fruit. And maybe if you're not dairy intolerant, plain organic yogurt with some fruit, nuts.
But you can get lactose, free yogurt as well and stuff like that. So.
The Mediterranean Method coming out soon, available everywhere. Dr. Stephen Masley, when we come back, we're going to talk about the bugs in your gut and how they influence your heart and your brain. We're going to talk about the infestation and making it positive rather than negative. Stay with us.
Welcome back. We are still here with our friend, Dr. Stephen Masley. You may have seen him on PBS. We are talking about the Mediterranean Method, his book that comes out December 31st. You can buy it anywhere the books are sold. We're having such a good time and talking about tips and what you can do to be healthier, to reverse heart disease and plaque, which I didn't even know you could reverse plaque. So that's really interesting. But today we're going to talk about the gut-heart connection. We've often talked about the gut-brain connection, so we'll touch on that today, but the gut-heart connection. So I'm really interested to hear about this.
And before we do, I have another one of these controversies swirling in my head. We talked to Dr. Stephen Gundry, and he's completely not a fan of beans because of the lectins on beans. So these are proteins that he says, and other people have said, I think the paleo people say this as well, that the lectins can increase leaky gut because they open the tight junctions of the gut wall lining.
Right.
So
But if you are in that camp, they're not all the same. First of all, cooking changes it, and also not all beans are the same. Lentils are softer than other beans. So that's a whole nother.
So, but
we
we should get the bean controversy out.
We should
What do
talk
you
about it.
think, Stephen?
Okay,
Have
well,
you
the
thought about
Mediterranean,
this?
Which has the greatest longevity on the planet. You know, Spain's just now overtaking Japan as number one, and actually Italy's probably going to be number two, and France and Greece will be 3 and 4. So the longest living people on the planet eat a ton of beans. And so what are the benefits of beans? First, they have the highest ORAC score, antioxidation score of any food on the planet. They block oxidation and internal rusting better than anything else. They're loaded with nutrients and fiber and B vitamins, and they're a good source of protein and calcium. I mean, there's so many good things about them, but lectins in beans do block some nutrient absorption, but beans are so rich, they overcome that. Spinach blocks nutrient absorption
Yes, it
for
does.
some nutrients,
Yeah.
but I don't say don't eat spinach. So they're a very nutrient-rich food. Now, there are probably, just like dairy and gluten, there are
Yes.
people who are intolerant. They have a reaction to lentils. And so if you get gut distress from eating lentils or lentils are probably the easiest. I'm glad you mentioned that. But if they bother you, avoid them. You know, if you have a dairy intolerance, don't eat dairy. If you're soy intolerant, don't eat soy. I mean, and I think probably 5 to 10% of people are really lectin intolerant and should not eat them.
That's
If
exactly
you're not
what I tell
intolerant-
people. Yeah,
Because he also
And
says
I-
cashew nuts have high lectins.
they
and so
do.
you
Well,
should,
all nuts have lectins. Most a lot of
avoid
foods have
them,
lectins.
But I love cashews.
Yeah.
The question is, and you'll like this. I tell people that, I've been in bad relationships in the past, and I have a great relationship with my wife. And, I'm only going to love people who love me back. I'm sort of done with the whole bad relationship thing. Well, it totally works with food, that I only want to love food that loves me back. It's a relationship. And so I guess what I'm hearing is if you love beans, but they don't love you back, you should break up with them.
right. And I love what you said.
I
There are
love
some,
that. I love the way you said that.
Yeah, and there are some people, like you said, who are much more sensitive than other people. And that's why one of the things I talk about is just like other foods, they shouldn't be your staple. I don't make them a staple for people. It's like, eat them in more moderation, eat them in smaller amounts, see how you react to them. If you're one of those people who are sensitive to them, there are some people that just rips up their gut. They just can't do it.
Then don't
Just
touch
don't.
them.
Right, exactly. But there are some people who can eat some types of beans and not others. The larger beans tend to cause more problems.
All right. So the beans took up way too much time. Talk to us about the gut-heart connection.
Well, this is emerging. It's really quite fascinating that your microbiome in your gut, we have trillions of, microbes there, 100 times more than we ever thought possible, 100 times more genetic material in our gut microbiome than there are in our whole body. It's this amazing organism that lives within us, and we have a symbiotic relationship. But your gut microbiome impacts your cholesterol, your blood pressure, your blood sugar, and your weight. Almost all the risk factors for heart disease are impacted by your gut microbiome.
Wow.
And now we even know that though your gut microbiome can make TMAO, this compound that's associated with heart disease that they're starting to track. The good news is if you're just eating, and most of it, I should have said, and most of that TMAO comes from eating meat, animal protein. So you could go vegan, vegetarian, and avoid it to protect yourself. But if you really follow a Mediterranean diet and lifestyle with the foods, that really blocks TMAO production and protects you. So it impacts all the risk factors. I mean, the relationship is much more profound than I ever thought. We've always known, well, not always, we've known for over a decade how important the brain-gut connection is. But I think the heart-gut connection is just starting to be revealed to us.
Wow, that's super interesting.
So what can people do to optimize their microbiome?
I mean, well, there's some things that really hurt your microbiome. So what things really attack your gut bacteria? Antibiotics. I mean, yes, if you have dying of pneumonia, take your doctor's recommendation. But 90% of the time, I would say the vast majority of people treated with antibiotics probably don't need them. And if we asked our doctor, could I wait and give this a few more days? Would that be safe? I would guess 90% of the time the doctor would say, sure, let's just watch and see how you do and see if you fight it off. Because we know one course of antibiotics messes up your microbiome for over a year.
Yep.
Wow.
Sweeteners, things like Splenda and NutraSweet and all these sweeteners that are in diet drinks and foods have a very adverse effect on your microbiome. So cutting out sweeteners is very important. The biggest factor, so those are two things to avoid. Antibiotics when you can, and not always, obviously, and sweeteners, which we could avoid 100%. But fiber is what feeds your gut. If you don't eat vegetable, fruit, beans, and nut, even if you take a probiotic, they'll starve to death. They have nothing to eat in your gut. So we have to eat fiber to nourish the good bacteria. And almost the more fiber, the better. And also we need some probiotic source. So either it's probiotic rich foods like organic plain yogurt and kefir, or kombucha or sauerkraut, there's so many miso, there's so many sources that we can now get a probiotic. So fiber and probiotics, and avoid antibiotics and sweeteners. And I think you would dramatically, just right there, you could dramatically change there's many more things, but I think those are the key essential steps to have a healthy gut to support your brain and your heart.
So many of our integrative medicine friends say you have to start with the gut because it impacts so many other things.
So I'd heard the same thing, that taking antibiotics can alter your gut function for over a year. But I had heard this, and I'm curious to know if this is true or just sort of a rumor I heard, that if you take antibiotics chronically as a child, like I did, it can actually alter your gut function permanently, that it's very difficult to get it back. Is that true?
It's more challenging. I wouldn't say impossible, but yeah, the more you take them, the bigger the challenge you are. If you're born by C-section, instead of a vaginal birth, if you got antibiotics as a child, it still impacts you as an adult. So, but what else are you doing? If you really take probiotics and you eat lots of fiber and you avoid the things that bother it, I think we can overcome that.
So we have to work a little harder, but we can do it. So you have to be vigilant, is what you're saying.
You'd have to be vigilant to overcome that. But I think it can be overcome. It's definitely not hopeless.
And what do you think about fecal transplants?
Well, they have some risks. So, there's infections that go with them. And then we've had a few people recently die who got a fecal transplant. So, if you've got a serious infection like, C. diff and it's not being controlled, I don't have any hesitation. But, some people are doing it for weight loss, and it works, it's working, but that's a pretty dramatic treatment for something that might be best addressed in other ways.
So maybe not the first thing to do.
Right.
You have just been so wonderful, Stephen. It's so nice to see you again.
Let's see a picture of your book again.
Stephen, you've just been so wonderful, and we're honored to be able to share your work with our Brain Warrior audience.
Yes.
How can people follow your work and learn more about what you have to offer?
Well, probably two easiest ways would either be the Mediterranean Method, available wherever books are sold, or they can go to my website, drmasley.com, drmasley.com, and I give out, I have a blog and free recipes that I give out and share with people on a regular basis.
Excellent. It's
Thank
been
you
such
so
a pleasure. If you're enjoying the Brain Warriors Way podcast, please don't forget to subscribe so you'll always know when there's a new episode. And while you're at it, feel free to give us a review or 5-star rating, as that helps others find the podcast.
If you're considering coming to Amen Clinics or trying some of the brain healthy supplements from BrainMD, you can use the code podcast10 to get a 10% discount on a full evaluation at amenclinics.com, or a 10% discount on all supplements at brainmdhealth.com. For more information, give us a call at 855-978-1363.